I was giving these pH test strips out to my fertility clients and having them test their first morning urine and cervical mucus. I want to show you how this simple test can offer great insight into your fertility. I want to make sure your cervical mucus is not too acidic that it's killing off your partner's sperm. It's an issue for many of us, and it may be behind the unexplained infertility diagnosis that so many couples get and don't know what to do with. My name is Charlene Lincoln. I'm a natural fertility specialist, and I became a first-time mom in my 40s. On this channel, I help you with fertility-friendly diets, lifestyle recommendations, testing recommendations, mind-body medicine. I try to inspire you with every video and more. Click like, and if you haven't before, subscribe if you're interested in taking charge of your fertility naturally. Dr. Sammy David is a reproductive endocrinologist in New York City and one of the early pioneers of IVF. He's criticized the IVF industry for not properly diagnosing women and instead just fast-tracking to invasive procedures. I'd like you to comment below if you feel like that's what your doctor is doing, and also comment, this is kind of random, but what you like to eat for breakfast. I'm going to be doing a video on fertility-friendly breakfasts, and I'm curious how you start your day. So back to Dr. David. He likes to diagnose why the couple is having fertility issues. That makes sense, right? And many times it's a fairly simple solution if the practitioner is willing to spend the time properly assessing and diagnosing. One priority of his is he makes sure his female patients are sperm friendly. One of the tests that Dr. David performs is a simple postcoital test the morning after intercourse. This test is used to evaluate the quality of your cervical mucus and to assess whether sperm are alive and moving normally. If he finds that the sperm are dead, David says the vaginal environment might be too acidic, for which he recommends a baking soda douche before intercourse. If the cervical mucus is too thick to allow the sperm to swim, he prescribes an over-the-counter cough medicine like Mucinex. Those are pretty simple solutions, right? So I want to show you how you can use a pH test strip to test your own vag pH at home. Now, I'm going to still encourage you to get a postcoital test, but this simple home test will show you what your pH levels are, and if they are consistently too acidic, you can notify your doctor and request that test. This test is going to be done around the time that you ovulate, and you're going to take a pH strip like this. Hopefully you can see like the color bars here. So I'm gonna, my hand is going to be the opening of the vagina. So what you're going to do in the morning is I want you to test your morning pH of your urine and of the inside of your vagina and basically the cervical mucus. So this is the inside of the vaginal opening. You're going to take the test strip, gently insert it, press it up against the wall of the vagina. You can bring it a little bit in, and then hold for about 5-10 seconds. And then take it out, and then let it sit. I think the bottle says for urine at least it's 15 seconds, and then you're going to read where you kind of fall into alkalinity or acidity on here. So I'll tell you what you're going to be looking for. And then with the second test strip, you're going to be holding it in into your urine stream for about 10 seconds and also waiting about 15 seconds. So let's talk about what you want as far as number-wise on both of them. So ideal vag pH for fertility, the most ideal pH level for women who want to get pregnant is 3.8 to 4.5 outside the days you're ovulating. Now, during ovulation, surges in LH are meant to maintain a pH level optimal to increase the chance that sperm reaches the egg. So you're going to look for a pH level that's between 7 and 12. Between 7 and 12, sperm can survive as long as 48 hours within the female reproductive system. That's exactly what you want. Now, ideal urine pH for optimal health is, you want your body to be slightly alkaline. So our body should be at a pH of around 7.3 to 7.4. Viruses and bacteria thrive in more acidic environments, so we want to keep it on the alkaline side for optimal health. Does that make sense? You have 2 test strips. One you're going to test around ovulation, the other you're going to test your morning urine, and then you can have a little journal and kind of keep track, and you want to keep it in those ranges. So you're probably wondering, how does pH affect your fertility? Well, sperm must travel through the vagina and the cervical canal before reaching the fallopian tubes to fertilize an egg. When the pH is imbalanced in the cervix or the vagina, it can damage the sperm enough to prevent it from fertilizing the egg. So it's very important. Now, these pH strips, they're very affordable. I'm going to give you a few links of where to get them, 20 bucks or less, and do it around the ovulation time. So if you find that the cervical mucus is acidic, you're going to want to look at your diet, reducing or eliminating sugar and refined foods, upping the greens, and using a baking soda douche before intercourse. I'll link a recipe below. And this is something that is very important. A fertility drug named Clomid, very, very popular. It's interesting and somewhat ironic that Clomid can make your cervical mucus more acidic and therefore hostile to sperm. I know it's got kind of contradictory, right? So that's why I think it's so important. Get the pH strips, test it, especially, across the board. But if you're on Clomid, make sure that it's not turning you too acidic. If it is, talk to your doctor. They can play around, I think, with dosages. And then, you might do the baking soda douche. You might use a intrauterine home device like Mosey Baby or Stork over the counter to bypass that. And that can be quite effective. Anyways, and then, change your diet and things like that. Making it more alkaline should do the trick. So if you found this video helpful, I'm going to, there's a few more on meditation and testing and diet. I have so many that I think are really helpful for you. And then also to download a free report on improving egg quality, improving sperm quality, IVF support plan, etc. in the description below. See you on the next video.